Dr. Sheila McGurk completed a residency in food animal medicine at the Ohio State University and received her Master of Science from the department in 1981. Dr. McGurk continued her studies, receiving her PhD in 1985. She joined the faculty of the School of Veterinary Medicine at the University of Wisconsin, where she rose to the rank of Professor of Large Animal Internal Medicine and Food Production Medicine, and has served as Director of Veterinary Medical Teaching Hospital and Associate Dean for Clinical Affairs. Another diplomat of the American College of Veterinary Internal Medicine, Dr. McGurk has been recognized as Veterinarian of the Year by the Wisconsin Veterinary Medical Association and has received the Norden Award for Distinguished Teaching at Wisconsin. She was also recognized as a distinguished alumnus of the college in 1997. In 2012, Dr. McGurk received the Dairy Industry Person of the Year. This World Dairy Expo Award recognizes excellence for research, development, education, marketing, manufacturing, or other fields that provides good or services to the dairy industry. So Dr. McGurk is going to talk to us about calf management and health. Thank you, Sheila. Go ahead.
Thank you, Jason. I appreciate that. Good morning, everyone. And Frank, it's always hard to follow you, but I've had that job before, so I'll try to do it. I see a lot of my Wisconsin friends are on the line, so let me get started. Jason asked me to approach this management and health perspective from the standpoint of the questionnaire that we'll be answering on the producers will be answering on the NAHMS study. So that's what I'm going to do. I'm not going to delve deeply into any subject, but hopefully bring some awareness to the questions that the calf health card will bring up. So from my view, calf health is obviously very complex, and management and health are closely intertwined. So in my simple mind, I always like to break things down into some basic components, and this always helps me analyze on farms what impact we can have to make things better. And so for the purposes of this slide, I've put what I believe are the major factors on the three-legged stool, because that sort of gives me the idea, or we can illustrate that once one of those legs is weak, calf health tends to be sacrificed. When two aspects of that stool are weak, then calf health really goes downhill. But when I look at all of the components together, I would say from the calving environment and calving per se, colostrum, nutrition, environment, and then the important aspect of monitoring and maintaining health are the components that I want to delve into a little bit in this talk. From my perspective, the calving, we're going to hear more about it, the calving environment is critically important, obviously, to the vitality of the calf. We know an unassisted vaginal delivery is desirable for the vitality of the newborn, and there are a number of complex mechanisms that are responsible for that. We're going to be asked to, in the calf health card, to talk about unassisted, easy, difficult, or mechanical surgical methods of delivery. And oftentimes the producers, that's a very subjective input from the producers, and not all are recorded accurately. So my point in making this slide is besides believing the check boxes of unassisted or easy, look around. In the top of this picture, the calf in the yellow is meconium stained, and obviously that delivery is compromised. The other thing is when we talk about, how soon are cow and calf separated, remember that, time to removal really impacts how much exposure this calf has had to the maternity pen environment, and that's an important thing. Again, if there are a lot of calves listed as unassisted delivery, but you find an evidence of a lot of dead calves, you know that the recognition of how easy a pull is different than what is intended in our survey. And again, I would just caution all of the coordinators of the study make sure that the understanding is clear, that unassisted and light assistance are clearly understood. And, you know, look, again, this slide is just there to emphasize, if you see dead calves, if you see cows with tails raised and evidence of vaginal trauma, you know, make sure that the entries are accurate. We won't be asked a lot, as far as I know, about the management factors around calving. But again, it's important to note when you're looking at stillbirths or calves that never leave the calving pen, average birth weight of the calf is an important thing to note. Some elements of nutrition are extremely important, body condition score, whether or not there's anionic salt feeding and how well it's monitored is a very important part of the aspect of newborn calf vitality. How many pen moves are associated from the far-off dry cows to the calving pen, and general health and vaccination status of the cows that are about to calve. Again, that's not a complete list of things we would be interested in if we're troubleshooting perinatal mortality on the farm, but those are some of the aspects that are probably relevant to us as the calf coordinators in this upcoming study. Relative to colostrum, I know you're all familiar with numerous ways of collection, sources, whether colostrum is pooled, whether replacement products are used, how it's stored, how long it's stored, whether it's tested, how long it is until calves receive colostrum. And again, that's oftentimes reported one way and actually done another way. So look for evidence, excuse me, look for evidence of the, you know, whether calves are dry and standing in the maternity area, where the colostrum is actually administered. As to volume fed, most everybody knows that calves should be getting 3.8 liters, 4 quarts in the first feeding or two. But to know whether that's truly done or not, again, look for the evidence. Is colostrum in 2-quart bottles? Is it in 4-quart bags? Oftentimes, you know, is the esophageal feeder a 2-quart or a 4-quart? This will give credibility to the answers that are filled in on the calf card, and we really want accurate data when we're looking at this new upcoming study. Colostrum preparation. Since the last study, many new tools are out there, from individual bags, illustrated here as the perfect udder bag, pasteurizers that can pasteurize colostrum and also do batch pasteurization, that can pasteurize individual bags, that can rewarm bags. Methods for rewarming, collecting, administering colostrum have advanced. So I think it will behoove us to know what some of those are and how often we find them on the farms, because we may see improved trends and we would like to know how to explain those. I think we don't have a lot of questions about colostrum replacement products, but I think it's well worth recognizing that they're commonplace on dairies, at least in the Midwest. Not all products are created equal. So when you're out there, I think it would be nice to note, relative to the dairy, what are they using, whether it's a colostrum or a serum or a whey-based product, what the concentration of immunoglobulins are, and what sort of amount is fed and how it's fed, whether it's fed in colostrum, diluted and put in colostrum, diluted with water, 1 or 2 feedings. So we may want to collect additional information to understand the importance of the colostrum replacements in the industry. Again, colostrum administration, don't just, when they say esophageal feeders, see if there are esophageal feeders really on the farm, or whether they're covered in cobwebs. Frequently, the people using esophageal feeders may not like to use them. They may have a 2-quart variety. If they use a 2-quart variety, they may not give a second dose. So I think it's really important to note whether there are 2-quart feeders, 4-quart feeders, how many are there. Overuse of a single esophageal feeder for many calves on a single day can be, the transmission of a salmonella problem and something that's notable. Bottles, we are still a little bit limited in the industry. There's a predominance of 2-quart bottles. A lot of farms, dairy farms, still don't like to use an esophageal feeder. So if we want calves to drink 3 quarts or more of colostrum, uninterrupted suckling is preferable. So again, note whether in the colostrum feeding area you can find 3-quart or 3-liter bottles are even out there now that would allow calves with uninterrupted and therefore maybe a much better chance of consuming an adequate amount of colostrum. Frequently, the dairies have a combined approach. If they don't nurse, they get an esophageal feeder. Again, we know there are different outcomes in serum total protein immunoglobulin concentrations when combinations are used. So I think making note of the fact that if an esophageal feeder is used, is it the backup plan or is it the primary plan? And then those dairies that just don't believe in using esophageal feeders and nursing, is the status, at what time, and again, what volume container is the colostrum placed in. I think we know nursing is not an effective method of colostrum administration, so keep the eyes open always on a dairy. This calf has been with the cow. It's already dry, so you know time to removal is at least an hour, probably 2 hours or more in this particular method of feeding colostrum. In my way of thinking about this and convincing producers to have early removal, this calf has had 3 manure meals. It got the first one when it was making standing attempts. It got the second one when it was teat-seeking on this cow and had its mouth on the leg and the flank and the brisket, and then finally got the final manure meal as it attached to the teat. So this is not a viable method of colostrum administration. Colostrum quality determination, we've inquired of our Wisconsin farms. I think the majority still probably use the colostrometer and use the colored markings on the colostrometer for good quality colostrum. They use the colostrometer, the majority in Wisconsin, or they use nothing. More, however, are using a Brix reading, since there have been papers to suggest that the Brix reading is temperature independent and fairly reliable, and a Brix reading of greater than 22%, suggesting that 50 grams or more per liter of immunoglobulin would be present. There are the calf-side Midland tests that will determine a colostrum quality, but we find that this is not used very much on many dairies. That actually is the calf serum test on the right there, not the colostrum-based test from that company. To help us work in collecting good calf health card information, it's always nice to look at the records. The records oftentimes are a little more accurate than the verbal reports of what's done. In this record, illustrated in this record, is that there's also a nice follow-up and feedback to the people administering colostrum so that you can see the serum total protein concentrations. You can see whether they got a colostrum replacement product and whether the colostrum serum-based test was good, and then the person administering it. So colostrum records, if they're present on a dairy, use them to help validate some of the things that are reported in the oral interviews. Monitoring passive transfer of immunity status. Recognize that it's different really when we're talking about individual calf basis or a herd basis. When we're looking at herd statistics as we are in this study, really the industry has given us a goal of saying that 1,000 milligrams per DL or 10 milligrams per mil of IgG as a serum concentration is what we're looking at. Most of us recognize that 1,000 may not be particularly predictive of good health. With the environments that calves are raised in, this may need to be 1,500 or 1,800 really to be a predictor of good calf health. But this is what we're looking at as a benchmark and is the basis for the kind of tests that we've said would be useful to look at to determine a herd-based status. So generally when we're looking at herds, we're looking at serum total protein or serum measurement of IgG status of calves that are at least 6 hours post-colostrum feeding. And because we're making herd-based assessment and we're looking at the proportion of calves that have a value of 1,000 milligrams per DL or higher, we are willing to look at calves that are beyond their peak IgG concentration, which occurs at 48 hours, and we'll look at calves that are all the way up to 7 days of age. If we use serum total protein concentration, we're really looking at sample sizes that can give us some clinical confidence, and that would be clinical confidence comes from maybe 60%, not 95% confidence interval, but we can usually get that from a sample size of 12 calves or more. And generally when you look at sensitivity and specificity that have been reported from previous works, most people will use benchmarks that we want 90% of the tested calves, population size at least 12, to be at or above 5.2 grams per deciliter, or 80% at or above 5.5 grams per DL of serum total protein concentration. And there will be variable criteria used, but when we reach those goals, then in general we feel relatively comfortable that the herd-based colostrum feeding program is successful. That takes continuous monitoring, once a week, once every other week, once a month, I would say at least, to establish that the herd continues to do well. And then again, of course, when we're looking at individual calf basis that some of us internists or individual animal people are looking at, we still have this industry standard of 1,000, but we look for higher levels than that to make sure that we're really looking at health rather than just a minimum goal. Tests for passive immunity, the traditional radial immunodiffusion test is the gold standard, and that will be used in the subset of calves in the NAHMS dairy study. Turbidimetric immunoassay and an ELISA can be used and are considered to be equivalent to an RID, but I believe, Jason, that we're going to still look for RIDs as our gold standard in this one. Serum gamma-glutamyl transferase, or GGT, can be a method not frequently used. GGT concentration is high in colostrum. Calves will transiently have a very high level of GGT after colostrum administration, but it's not a good predictor or reliable predictor upon which we have enough sensitivity and specificity to use it for criteria in this study. In terms of calf-side testing, the most common one we see on dairies is acquisition of a serum total protein concentration. Lateral flow immunoassay, the Midland kit, is still used, and now a Brix reading is used, and I'll show you in the next slide. This comes from limited data, but good data, a relatively recent study that showed that the Brix reading, in fact, these were only 48-hour-old calves. The Brix reading did predict an IgG estimation, And the references here, they looked at a minimal reading of 7.8 as a cut point for failure of passive transfer. So again, I think we see more and more Brix refractometers on dairies for monitoring milk feeding, monitoring colostrum status, and now potentially we may see people branching out and looking at a Brix reading to determine IgG status in newborn calves. Again, I think the tool you'll see most on farms are refractometers. The goals, again, as I stated before, for herd-based testing, up to week-old calves can be used, and the same cut points that I reviewed in a previous slide. The Brix refractometer is out there. Again, the Brix, or this is a Palm Misco. This refractometer has multiple functions, of which Brix readings and digital serum total protein concentration are on it, and quite accurate. There are Miscos that do more functions than that. The accuracy of IgG measurements in serum, IgG measurements in colostrum needs some better updated validation. But this is a Misco that both the Brix reading and the digital serum total protein can be done on the same refractometer and are relatively accurate. Another little scheme laying out herd-based colostrum testing. When we're looking at proportional-based testing, the emphasis is on the calves that fall below the cut point. So as illustrated here, if we're using a cut point of 5.5 grams per DL, and we say that we'd like to have fewer than 20% or fewer below the cut point, you can see that if we test 12 calves, there's no, in 12, a sample size of 12, there's no perfect 20%. But obviously, if we have only one or none of the calves that are below the cut point, there would be no risk of failure of passive transfer in that herd. If we have 2 or 3, on the other hand, that fall below the cut point looking at 20%, we have to say there's borderline confidence in that test. So we need to test more, or we need to test more often. And then obviously if we have 4 or more below a cut point in the purpose of this colostrum-based testing using 5.5, then clearly we would say that that herd is having a problem with failure of passive transfer. Okay. So continuing on the theme of sort of the basic components of calf health, let's move on to nutrition, and this will not be an in-depth discussion of nutrition. Suffice it to say that all of you encounter the same things I do, that there are many feeding types. There are the delivery and the components of the feeding, and the housing on dairies all over the country and north of the border are very, very different. Some are outside, some are indoors, some are mob feeders, some are group feeders, and the industry will continue to change. The milk sources, as I see most commonly, are going to be for dairy calves, whole milk, milk replacer, or combinations. When we look at whole milk, it can be, oftentimes it's pasteurized now. It may be non-saleable unpasteurized. It may be saleable milk. And frequently there are combinations even of the whole milk product. Amongst milk replacers, many varieties of crude protein and fat combinations. There may even be a difference in seasonal use. There'll be a breed use with some milk replacers that are specific to jerseys. There will be milk replacers that are acidified. This is pre-delivery acidification. And there'll be non-acidified milk replacers. And again, you'll find dairies that combine whole milk with milk replacers, because either there's a milk replacer or a balancer that may be used when whole milk is the source of the primary source of liquid feed. The combination of an additional milk replacer or a balancer may be added. Just to give a basis, kind of a crude basis for comparison, again, the industry recognizes that whole milk has an admirable concentration of protein and fat for optimizing genetic potential of calves. So I think it's useful to know that on a dry matter basis, when we feed whole milk, if we look at averages, probably whole milk on a dry matter basis is 26 to 27% protein and 30% fat. And then you can look at total solids over in this column, but I'm going to focus on the protein and fat. When we look at milk replacers, we can see anything from 18% protein all the way up to 28% protein, and we can see fats down as low as 10%, although that's unusual nowadays, up to 30% or 28% fat in milk replacers. Again, total solids are here on this side. The milk replacers that look more close to being what whole milk are, we kind of label them as accelerated or intensive feeding. Maybe it's more appropriate feeding, but these generally are not as common as the traditional 22-20 milk replacers, but are becoming more and more common on the dairies. Growth objectives have been hammered by the Dairy and Heifer Association and have general agreement amongst dairy scientists and veterinarians. And we talk about goals of doubling the birth weight by 56 days of age. When you look at that in reality figures, that a 90-pound calf would be 180 pounds by 56 days of age, you look at an average daily gain of 1.6 pounds per day. And a lot of dairies are still hovering around 1.2 pounds per day average. And so the awareness of this and the thrust of improving nutrition to get to these desired double birth weight by 56 days has taken on some momentum, but I think we still have a long way to go. In this scheme, we talk about decreasing the liquid feed somewhere between 7 and 8 weeks, and decreasing it, again, if it's multiple day feeding, multiple times per day feeding, we decrease it by 50%. In 2-time-a-day feedings, we like to see the decrease by half occur by just feeding 1 feeding instead of 2 feedings. And it tends to be in this last week where we decrease the milk feeding that these calves, especially if they're on a higher plane of nutrition, tend to really start to ramp up the starter intake. Under this scheme of weaning, calves would be off their liquid feed by 56 days. Previous NAHMS studies have shown us that average weaning age has been pretty consistently around 8 weeks, but a lot of producers these calves may not be fully weaned by 8 weeks of age or 56 days. In general, we like to see calves not move, have too many changes at weaning time. Most of them need 4 to 7 days after the liquid feed is taken away to recover and really increase their starter intake. For the most part, the industry still abides by the fact that we feed limited forages until calves are consuming about 5 pounds of starter. Again, there are some newer views of how to deliver forages, shorter, chopped, incorporated into starter, to make texturized starters, so this may change a little bit. But in general, we know that we can achieve good rumen health if we delay the introduction of dry forages into the ration until we can get calves to consume about 5 pounds of starter per day on average. In general, again, this is subject to change, and we see total mixed rations, abbreviated here as TMRs, being introduced earlier and earlier, but done before 5 months of age, it certainly should be done as a dry TMR, not a lactating cow TMR, and it should be done with caution and with care and with adjustments on a slow, steady basis. To get to our goal of doubling birth weights, we know that if we go back to that original chart where I put solids, if we feed calves close to 2 pounds of milk solids per day, calves will double their birth weight, and they will achieve withers height growth and meet the goals that we expect by weaning time. And as you've been reading about, we know that the impact of this early nutrition does seem to predict a very strong productivity and a value for that in first, second, and maybe all the way up to third lactation performance. So with more milk consumed, in addition to being more productive replacement heifers, we know that calves have fewer health problems. So the immune status of a calf is boosted by good nutrition. So again, that emphasizes that calf health is great, very closely linked to management factors, not the least of which would be nutrition factor. Winter in our neck of the woods and many areas, calves really are thermoneutral and, from 55 to 58 degrees Fahrenheit when they're newborns. Once the temperature is below that, they need added energy to maintain body heat, and so they need to be fed more. And so particularly with extreme weather that the country has had this year, a lot of interest in feeding programs and feeding more in winter. So emphasis here is that depending when we collect our data, we want to make sure that what we see or what's reported has impact both in winter and summer, because we've certainly stressed that the need to increase volume, solids, number of feedings, or adding some nutrients is a solution for cold weather feeding. So make sure the data we collect is accurate for the season or for the year. Lots of variables in how feed is delivered, and it's never just as simple as the product that's fed on the dairy. Even with whole milk or with milk replacers, the total solids can vary, and we have recently shown some data where the total solids between calves, between feedings, between dairies is very, very significant. And it may vary from the temperature at mixing, how the mix continues to be agitated and delivered. You can imagine that the first calves that eat out of this robotic mass feeder here will get a totally different product than the calves that come by 2 or 3 hours later and clean up the rest of that milk. So total solids is a significant variable that we need to get a handle on. The temperature at mixing and feeding, not just for the digestibility for the calf, but also for the impact of the temperature at mixing on the total solids measurement. How it's delivered, single bottle, tank, whether it comes out of the bottom of the tank, whether it comes out of a tank that has an agitator, what the additives are. As it could be as simple as coccidiostats, but it might be nutrients added, it might be oligosaccharides additive, it can be a number of additives. The additives may be a morning feeding, not a night feeding. It may be for calves 0 to 14 days of age. So knowing what's going into these calves is extremely important. What's the timing of feeding is important. Again, I bring up acidification, and it can be pre-acidified as it may be in a milk replacer. It can be acidified at the time of delivery to preserve bacterial quality, and usually it's acidified if it's a whole milk product, but there are people that acidify milk replacers if they're going to sit out in a mob feeder during the day. And again, liquid feed, Water is an essential component to that, and when and how it's delivered, how much calves have access to that is very, very important. We can monitor or we can measure total solids. We can measure total solids or estimates of total solids by looking at a Brix reading. We can calculate total solids, and if we just look at 10 ounces of milk replacer going into 2 quarts of water, we can figure out easily that that should be a 13% solids mix. If the total solids measured is not 13% solids, then we can go back and troubleshoot and see what that is actually fed. The Brix reading is based on, it's a food industry tool. It's based on sucrose concentration. So the Brix reading may not be an accurate predictor of the total solids. But for us, we can figure out the relationship of the Brix reading to the solids in a milk replacer just by running a standard curve. So we would, if the farm is mixing up at a 13% solids, we'll run 10, 12, 14, 16% solids, make a standard curve, take Brix readings at each of those, and then determine the relationship of the Brix reading to the actual solids. And then the farm or the veterinarian or the industry specialist nutritionist can monitor how well that product is delivered. The total solids affect emptying, affect microbiota, affect motility. And while we could argue about what's the best way to manage these and what the goal should be, I would say if we go for the goal that the total solids would change less than 1%, certainly less than 2% between feedings, between days, between calves, I think we'll have better health. We'll see more consistent stool consistency, less nutritional scours. If we can keep total solids less than 18%, I think we'll have less abomasal disorders, abomasitis, abomasal ulcers, and things like that that seem to plague us, particularly in the winter weather when water isn't delivered regularly with feeds. All right, that wraps up the nutritional part of it. Let's get through the environment and try to stay on my time frame here. So environment, again, it's a critical piece of calf health, and the management of the environment for comfort and cleanliness and dryness is illustrated here, that the calf environment isn't just where they live, it's where they're born, it's where they congregate before they get to their permanent housing. It may be little tools like this, drying boxes, transport carts, trailers that take them to the calf raiser. Beyond this part of the environment, it's feeding equipment, it's the feeds, it's the people and the pets and the pests. And all of these are an important aspect of the environment and the control of the environment that we need to have. When we keep it just to housing alone, we have individual pens and we have group housing. We have individual pens inside, we have individual pens outside. You know, when we look at environment, we can put some goals there. We can keep it very simple. Calves are entitled to be clean and dry and draft-free, and I'm sure the presenters after me are going to delve more into it. You know, some critical pieces for me is if we want it to be clean and dry, then we don't dump feed refusals, particularly those liquid feed refusals in the area where calves are housed. If we have individual pens, let's have 15% more pens than calves at maximum occupancy, so there's time to clean and prep and move and manage these to reduce the bacterial flora in the environment. Should be comfortable. We can talk about nesting. We can talk about exhibition of normal behaviors that I'm sure will be covered in the next talk. And it's consistency. Limited number of moves. Let them get accustomed to the calves that they are going to be living with. If there are changes, make them gradual, give them time for adjustment. And again, I'm sure this will be covered again in much more depth. Remember that housing, again, just bedding itself can distance calves from exposure to pathogens that are transmitted by fecal-oral transmission. We know that bedding influences respiratory disease just by the aerosolized counts around the calf. So the environment, again, is critically important. And to stay on my time frame, I'm going to leave these goals to probably coverage in the next talk. Let me finish up the talk with something I'm very passionate about. Calves, like cows, need health monitoring to maintain good performance in the calves. And health evaluations have traditionally been done by observations in and around feeding. And we know that observations simply around appetite are not reliable. And there are many, many aspects of health evaluation, from perinatal mortality to, screening on a daily basis to screening on a weekly basis. What parameters should you use? It's all about looking at what is on the farm for a treatment protocol, when calves are vaccinated, how many people are allocated to get the job done, and whether there's some competence and good communication and focus when we look at health evaluation. And perinatal mortality, again, who's looking, how often are they looking? What is their understanding of normal behavior, and when are they trained to go in and assist, and how? Managing calf health, in my view, takes a team that's out there for daily observation. It probably takes at least 2 times a week, surveying more deeply for the most common diseases like respiratory disease and diarrhea, and then a defined process. And the defined process is going to vary amongst the dairies, but we know that there's merit to early detection. And if we have early detection, a solution to a diarrhea problem might simply be giving oral electrolyte products or some other management like that. Early detection of respiratory disease is more effective and most likely going to result in a cure so that calves don't take respiratory disease into the post-weaning group housing. Any health evaluation should be looked at from the standpoint of people like us, that it should never penalize a calf. It shouldn't penalize the people doing the screening, the people doing the examiners, or the treatment crew. So if the boss says too many antibiotics are used, the treatment crew is going to feel the pressure. If the treatment crew is, pissed off that the examiners are finding too many calves to treat, the program health management won't be successful. So the devil is in the details. To quickly finish up, I would say recognize that it takes time. And these come from some Wisconsin studies where there were a bunch of housing, different types of housing, but it would, at least by the estimates in the Wisconsin study, 1 full-time equivalent per 100 calves just for routine chores. And if we look at additional health management, you're going to have to add a minimum of a half-time person to that. And that will vary greatly depending on the operations and the specialty. It takes a process that's fully defined. Here's a flow chart I use for one of the dairies I work for, but what? Daily calf observations, who does it, what do we look for, and how do we communicate it so that the information gets to the calf and gets into the records. And I think with that, the rest of the slides are certainly communication and how it's done, what parts of the exam that you emphasize on dairies will vary, but these are some of the things. I have the full examiner. When a calf is examined in depth, these are some of the parameters that we look at. We like to train people to look at calf deaths, post pictures, transmit them to veterinarians to look at. If this is a perinatal mortality, this is a calf that never breathed, and you can see the impact of the hard delivery on the organs that can be captured here. And the screening processes, whatever it means, It means that health evaluation and management is complex, and it needs to have a process and a monitoring scheme, and we need to stay on top of that. My time is up. Jason, I don't know if there's time for any questions, but that's a rapid overview of a complex subject that I have a great deal of passion for, and I hope there's at least something that you can take away from that overview.
Thank you, Dr. McGurk. Another excellent presentation. We have time for a couple questions if anybody has one or two. All right, well, I think we'll go ahead and move on. I guess the really thing that this highlights to me is in previous NAHMS studies, we asked how much they fed and how frequently they fed it. And the 2 quarts twice a day is kind of a thing of the past as far as a routine feeding for dairy calves. It's getting a lot more complicated. So thank you again, Dr. McGurk.